Silent signs of dementia you should never ignore. Have you ever walked into a room and forgotten why you came in? Most people over 60 experience small changes in memory. But some changes are not normal aging. They are early silent signs of dementia that people ignore for years, until it's too late. Today, I'll guide you through 7 warning signs you should never overlook. Dementia begins quietly, in ways many dismiss as stress or fatigue. These signs appear years before diagnosis, and catching them early can protect your independence and quality of life. The earliest change is not memory, it's behavior. You may notice becoming unusually irritated, losing patience easily, feeling emotionally flat, withdrawing from friends, or experiencing sudden anxiety you never had before. These shifts happen because the brain's frontal lobe, our emotional control center, begins to weaken. Many families mistake this for aging. But sudden personality shifts are one of the first clinical signs doctors watch for. When someone who has always been gentle becomes short-tempered, or someone outgoing becomes isolated, this is about consistent changes lasting weeks or months. The frontal lobe controls impulse regulation and emotional responses. When it deteriorates, people lose their social filters, or show emotions out of proportion to situations. Family members often describe it as the person seeming like a stranger. The second sign is struggling to find everyday words. This isn't forgetting a cousin's name. It's saying, you know, that cold thing, the refrigerator. Pausing mid-sentence, knowing a word, but unable to say it, or replacing words incorrectly like hand clock instead of watch. This happens because language pathways connecting memory centers break down. The person visualizes the object but cannot retrieve the word. In early dementia, this happens frequently with very common words. You might notice someone using general terms like thing or stuff instead of specific nouns, or describing what something does rather than naming it. These are compensation strategies when the direct pathway to a word is damaged. Problem-solving ability declining is one of the most dangerous signs, because it affects independence. Bills become confusing. Following familiar recipes becomes difficult. Planning trips or managing medications gets overwhelming. Simple technology becomes frustrating, and money management suffers. If someone who has always been organized suddenly becomes confused, that's cognitive decline. The ability to plan and execute complex tasks requires executive function, controlled by the prefrontal cortex. When compromised, even familiar multi-step tasks overwhelm. Someone might put ingredients in wrong order, forget critical cooking steps, struggle with their checkbook, or make uncharacteristic money errors like falling for scams. These changes signal that someone may need assistance with daily activities. Losing track of time itself surprises many families. Not just dates, but time feeling strange. Watch for difficulty knowing what day it is, morning and evening. Blending together, confusion about how much time passed, or thinking recent events happened months ago. The hippocampus, the brain's timekeeper, is one of the first regions damaged in Alzheimer's and other dementias. It handles memory formation and our sense of temporal order, helping us sequence events. People with early dementia lose track of seasons, forget whether they've eaten, or become confused about whether something happened yesterday or last week. They might prepare for appointments days away as if they're immediate. This temporal disorientation can manifest as confusion about one's own age or believing deceased relatives are still alive. These aren't simple lapses, but fundamental disruptions in how the brain processes time. Vision and spatial problems reveal that dementia affects how the brain interprets what you see, not just memory. Signs include difficulty judging distances while driving, misreaching for objects, trouble reading because words seem to move, bumping into furniture, and feeling dizzy in unfamiliar places. Many assume eyesight is worsening, but the issue is the brain. The parietal and occipital lobes process visual and spatial information. When dementia affects these areas, people experience visual spatial dysfunction, struggling to determine where objects are or judge distances. Driving becomes particularly dangerous, misjudging distances to other cars, difficulty staying in lanes, confusion at intersections. At home, they pour liquids and miss cups, have difficulty with stairs, or struggle perceiving depth. Reading becomes challenging not from vision loss, But because the brain cannot process the spatial arrangement of letters, text seems to move or jump around, repeating questions and stories, without realizing it is very different from normal forgetfulness. In dementia, the brain does not store new short-term memories. Someone asks, "What time is the appointment?" again and again, even after receiving the answer, or tells the same story multiple times daily. It's not intentional, it's the brain failing to create new memory pathways. Short-term memory relies on the hippocampus to transfer information into long-term storage. When disrupted, new information never gets encoded. The person asks repeatedly because from their perspective, they've never received an answer. This is distressing for families because it feels like the person isn't listening. But their brain physically cannot hold onto new information. They tell the same stories because they don't remember telling them recently. Long-term memories from years ago remain intact, while new memory formation is severely impaired. Someone recalls detailed youth stories but can't remember breakfast. Poor judgment and risky decisions are often the scariest sign. Examples include falling for scams easily, overspending on unnecessary items, leaving the stove on, wearing summer clothes in winter, and trusting strangers too quickly. This happens because the prefrontal cortex controlling judgment weakens. Families say, "That doesn't seem like them. Something feels off." They're right. Good judgment requires integrating memory, reasoning, and emotional regulation. When the prefrontal cortex deteriorates, people lose ability to assess risk, consider consequences, and make sound decisions. This has serious safety and financial implications. People with early dementia become prime scam targets because they lose natural skepticism. They give out personal information, send money to strangers, or make large unnecessary purchases. Safety risks increase: forgetting to turn off appliances, leaving doors unlocked, wandering into danger, or dressing inappropriately for weather. Social judgment changes too. Previously reserved people might make inappropriate comments, overshare, or behave out of character. When two or more of these signs appear together, doctors urge families to act. Look for combinations: personality change plus word-finding issues, repeated questions plus time confusion, poor judgment plus social withdrawal. These clusters almost always mean early dementia or mild cognitive impairment. MCI is often a dementia precursor. Not everyone with MCI develops dementia, but many will. Multiple symptoms from different cognitive domains significantly increase likelihood. Document these changes with notes about specific incidents, timing, and frequency. This information is valuable for healthcare providers who rely on family observations, because the person experiencing decline often lacks insight into their deficits. Early diagnosis enables interventions that slow progression and allows planning, while the person can still participate in care decisions. Get a cognitive screening: quick, non-invasive tests by your doctor. Using tools like the Mini Mental State Examination or Montreal Cognitive Assessment. Improve brain blood flow through walking, hydration, and quality sleep, as cardiovascular and brain health are intimately connected. Reduce inflammation with anti-inflammatory foods like fatty fish, berries, leafy greens, and nuts. Keep your brain active with reading, puzzles, conversation, and learning new skills to maintain cognitive reserve and create new neural connections. Social engagement is particularly important. Combining cognitive, emotional, and physical activity. Protect your daily routine: consistency helps slow progression. Regular sleep schedules, meal times, and activities provide structure, compensating for declining abilities. Dementia whispers years before it speaks loudly. If you recognize these silent signs in yourself or someone you love, remember, early awareness is not fear, it is protection. It is the power to stay independent longer, the chance to prepare and live fully. Knowledge gives you options. When you identify changes early, you have time to explore treatments, make lifestyle modifications, arrange support, and make important decisions, while you can still actively participate. There is no shame in cognitive decline. It is a medical condition, not a moral failing. Seeking help early demonstrates strength and wisdom. You know your body better than anyone. Listen to it. Pay attention to subtle changes. Trust your instincts when something feels off. Don't wait for a crisis. The earlier you act, the more tools you have to maintain quality of life and dignity. Your future self will thank you for the courage you show today.